Adventist Health is hosting a free lunch and learn event on May 26th to give you a better understanding on a stroke, responding to the signs quickly and steps to reduce the risk. Joining us in Studio B this morning is Joyce Navarro, stroke coordinator with Adventist Health. Good morning.
Good morning.
Thank you for getting up with us.
Well, thank you for having me here today.
First of all, let's start with just the stroke overall and look at some of the symptoms. What is the most overlooked symptom when it comes to strokes?
I think the most overlooked symptom is probably when it comes to blurred vision, dizziness, and unsteady gait, because most people don't associate that with stroke symptoms or stroke warning signs. So we do have a really great mnemonic that we call Think Be Fast. When you Be fast when you're thinking about stroke-like symptoms. So the B is for balance, so unsteady gait, dizziness. Okay. The E is for eyes, so blurred vision, double vision, or loss of vision in one or both eyes. F is for face, so you're going to look for facial symmetry, facial droop or weakness, or even numbness. They may complain about that first. And then A is for arm. It's catchy. We use arm, but it could be the arm or the leg. And that is for arm weakness or a drift or even numbness and tingling as well. Okay. And then the last one is going to be speech. So we're talking about slurred speech or an ability to speak or an ability to comprehend the other person. And then T is for time. So we want everybody to know it's a critical time emergency and call 911.
So what do you think it is? Do you think most people think, oh, I too much sugar, I had a, something that simple? They dismiss it.
A lot of them have underlying other conditions like blood pressure, blood sugar control issues. So they may think it's my blood sugar, it's low, my blood pressure is too high, and they may dismiss the symptoms thinking it may go away in a few minutes, and they realize an hour into it that it hasn't gone away, something is wrong, or it's getting worse. And usually around hours 2 to 4 is when people show up to the hospital.
2 or 4, but I mean, you were mentioning this already about be fast, just from that standpoint. How critical, it comes down to minutes, not hours, right?
Correct. Every minute that passes, about 1.9 million neurons get lost. So those are brain cells that will never be regained. So in the hospital setting, we do have something that says time is brain. Every second is critical. And really, even when the patients show up between hours 2 to 3, even the treatment that we offer, it is time dependent. So we do want to stress it. Call 911. If they call the EMS system, they know where to take them. They alert us and we prepare, and we can make quicker decision when the patients arrive to the hospital.
Talk a little bit about this lunch and learn event coming up on Tuesday, May 26th.
So that's one of our community neurologists speaking out to our community, and it is a great event because it's hardly ever offered. We did this last year and it was pretty successful, and we wanted to redo it as we had a lot of good feedback about a lot of the patients about things that they didn't know, didn't learn, or who it affects the most. So the neurologist will be speaking about basics of prevention. They'll be talking about stroke symptom recognition, and then as well as treatment. What happens when you arrive to the ER? What can be done? Yeah.
And how do people sign up or get more information on that?
So there is a flyer, or they can go through Adventist Health, and it'll give them a QR code to sign up. It is a community luncheon, so it'll be free lunch provided with us. And so come and learn. We're all excited to see everyone come out and just really gain more knowledge about stroke.
And I want to leave with this. I think there's this belief that you have to be a certain age to be at risk for stroke, and that is absolutely not true.
It's not true. It is true that it increases with age. However, it can happen at any age, which is really important that we do recognize the symptoms in anyone and every single person.
Joyce Navarro, stroke coordinator with Adventist Health. Thank you for coming in this morning.
Thank you so much.
We'll be right back.